Hello, and welcome to Riverside's Heart Month lecture series. In honor of Heart Month, Riverside is excited to be presenting a new community lecture on a different cardiovascular topic each Thursday this month. Today, we will be focusing on women's heart health. Over the past few years, there's been an increasing awareness of the fact that cardiovascular disease is the #1 killer of women, but many women are still unaware of some of the unique symptoms and particular concerns about women's heart health. Tonight, we will be hearing from Dr. Alexandra Ward, who is the medical director at the Riverside Women's Heart Center. There will be a lot of information covered, but the beauty of video is you can rewind and listen again if you want to rehear any particular part. Or for additional information, please visit the Riverside Women's Heart Center website at www.riversideonline.com/women's heart. With all of that in mind, let's get to tonight's presentation. And without further ado, I will turn it over to Dr. Ward. Dr. Ward?
Welcome and thank you for joining our talk today regarding taking a stand against heart disease, everything you need to know about cardiovascular disease in women. I am Dr. Alexandra Ward, a cardiologist with Riverside Cardiology Specialists and the director of the Riverside Women's Heart Center. And I'm delighted to be talking to you today about heart disease in women, a topic very near and dear to my heart. So why do we focus on women's heart health? Why is this important? Heart disease is the leading cause of death in women across the world. 1 out of 3 women will die from cardiovascular disease. Additionally, 1 in 3 women will be diagnosed with heart disease during their lifetime. That is more than any of the cancers combined. So it's very important to know about women's heart disease, know the risks, and know how we can impact that. And interestingly, more women die from heart disease than men do. There is 1 death from heart disease in women every minute. So if you think about while we're on this talk together for approximately 15 to 20 minutes, that's 15 to 20 women who will die from heart disease during that time. So very important to talk about, to know about, and to understand. That being said, only 44% of women are aware that heart disease is the leading cause of death in women. That's the reason that the American Heart Association has started the Go Red campaign and why we focus so much on women's heart disease during the month of February and during Go Red. Additionally, less than 25% of women are aware of the traditional risk factors such as high blood pressure and high cholesterol as being risk factors for heart disease. Less than 50% of women know the symptoms of heart disease. So we really need to do a better job as a healthcare community in raising awareness for our females out there to really show the impact of heart disease, what those risk factors are, and those signs and symptoms so that women and their loved ones are aware of these things. So let's go over the types of heart disease. Most people, when they think of heart disease, think of coronary artery disease or atherosclerotic disease, which is a blockage in an artery, or atherosclerosis. Additionally, there's heart failure, both systolic, which is the pumping function of the heart, or diastolic, the relaxing function of the heart. There are congenital heart disorders, meaning things that you were born with, inflammatory heart disease, so inflammation of the heart muscle. Pericarditis is inflammation of the sac around the heart, and then myocarditis is inflammation of the heart muscle itself. Valve disease, infectious conditions, such as if there's bacteria in the bloodstream, this can impact valves of the heart. And then abnormal heart rhythms or arrhythmias. The most common one we hear about is atrial fibrillation. Then there are types of heart disease that fall into these various categories that are more prevalent in women. That includes microvascular angina. So that's not big vessels of the heart causing problems, but the little vessels of the heart causing problems, meaning there are no big blockages we can find, but women are still having chest pain symptoms. That falls under MNOCA, which is myocardial infarction with no obstructive coronary artery disease. So we see by a blood test level that there has been damage to the heart muscle, but there's not a big blockage that caused it. So microvascular angina falls into that category. Takotsubo cardiomyopathy or broken heart syndrome falls into that category as well. And Takotsubo is a stress-induced cardiomyopathy that we do see more often in women than in men. Additionally, SCAD, or spontaneous coronary artery dissection, is also seen more commonly in women than men, and it's more commonly seen in younger women, especially around childbirth. And coronary artery vasospasm. So now that we've spoken a little bit about the types of heart disease that we're talking about, let's go over the risks for heart disease, because the biggest thing that we can do to impact heart disease is really mitigating risk and prevention. So here are the traditional risk factors we think about, meaning we've known about these for quite some time. They impact both men and women, and that is smoking, high blood pressure, high cholesterol, diabetes, and obesity. Women with any of these risk factors actually have a higher risk of developing heart disease than men with the same risk factors. This is why it's so important to know your risk factors, to talk to your healthcare providers about them, and to try and mitigate as best we can, because the risk is so much greater for women. So smoking is actually the most preventable cause of heart disease in women, especially women under 50. It is a dose-dependent relationship, meaning the more you smoke, the higher your risk, or the longer you've smoked for, the higher your risk, and secondhand smoke does count. High blood pressure is more common in women than men over the age of 55. And the risk for developing heart disease, again, is higher in women who have high blood pressure than in men. Diabetes removes the female protection against heart disease. So women who are still menstruating are protected from heart disease due to estrogen. After menopause, that protection goes away. Or if a female is premenopausal and has diabetes, that protection actually also goes away. So very important if a woman has diabetes to be very aggressive with good glucose control. Same thing with cholesterol and obesity. So these risk factors, again, are common in both men and women, impact men and women's risk of developing heart disease, but women have higher risk of developing heart disease than men with these risk factors. So now let's talk about the female-specific risk factors for heart disease. And those are listed down below. So we'll go through the first ones initially, and we'll go to pregnancy-related on the next slide. So polycystic ovarian syndrome, or PCOS, menopause, that's whether it's surgical or natural, and timing of menopause, autoimmune disorders, certain breast cancer treatments, and depression and anxiety. Polycystic ovarian syndrome is thought to be an increased risk for heart disease due to the alterations in estrogen. Again, we know estrogen is protective, and in PCOS, there's altered estrogen levels. Additionally, the risk of metabolic syndrome with PCOS is higher. Menopause, earlier age of menopause, or an early surgical menopause increases the risk, again, because of the removal of estrogen. Autoimmune disorders increase risk for women. Again, some breast cancer treatments, including radiation and certain chemotherapies, increase the risk of developing coronary artery disease, valvular disease, or heart failure, and depression and anxiety. So it's very important, again, to know these specific risks for women and to make sure that we're aggressively treating these. And now we'll talk about pregnancy. So pregnancy is nature's best stress test. Blood volume increases dramatically during pregnancy and increases dramatically during the first trimester. Additionally, heart rate increases through each trimester, reaching a peak in the third trimester right before delivery, and blood pressure changes. There is some cycles during pregnancy of blood pressure where we see sometimes a decrease, then an increase, then a kind of leveling out. But for some women, blood pressure increases to the point where we have to do something about it. And that's gestational hypertension, preeclampsia, and eclampsia. So these are the pregnancy-related factors for heart disease. And so these are the things that we think about also in part of the women's specific risk factors. So we talked a little bit about the hypertensive disorders of pregnancy, and we'll get into that again in a moment. But gestational diabetes, low for gestational age birth weight, and preterm birth before 37 weeks are also risk factors for heart disease in women, just like high blood pressure, high cholesterol. And this can be whether this happened 30 years ago or 3 years ago. So these are risk factors to talk to your healthcare providers about, as it does impact an increased risk of heart disease. The blood pressure disorders during pregnancy are particular ones that we care about. And that's, again, gestational hypertension, which is hypertension that is diagnosed after 20 weeks gestation. Preeclampsia, again, high blood pressure after 20 weeks gestation with either protein in the urine or signs of systemic disease, which can be a variety of factors. And then eclampsia, which is preeclampsia plus the grand mal seizures. Having any of those blood pressure disorders during pregnancy increase getting high blood pressure later in life, but also increase the risk of having abnormal lipid panels, metabolic syndrome, and coronary disease in addition to vascular disease. So we know that any of those blood pressure disorders during pregnancy really do impact heart disease later in life. And so what is the risk? So here are just some of the numbers and the percentages of if a woman had these cardiovascular complications of pregnancy, which is what we call them, the increased risk of heart disease later in life is listed below. So gestational hypertension increases the risk by 67%, gestational diabetes, placental abruption, stillbirth, and then preeclampsia, you can see the difference between moderate or severe preeclampsia. So these are quite impactful and do make up a significant risk proportion. So it's important to talk to your healthcare provider. Again, if you've had any of these during pregnancy, even if that was 20, 30 years ago, because the risk is a lifelong risk. So now that we've talked about all the risks, how do we decrease your risk? How do we modify? We call it risk factor modification. So the most important thing to know is what is your risk? Do you have any of those traditional or gender specific risk factors? Then heart healthy eating, very important, regardless of age. And I always say my preference is the Mediterranean diet, which is not a diet at all, but just good heart healthy eating. So that's lean proteins, fresh fruits and vegetables, and whole grains. Exercise, and exercise is whatever you like to do that gets your heart rate up. So it can be walking, hiking, running, biking, whatever you prefer, and at least 30 minutes, at least 3 times a week. And then of course, discussing all your risk factors with your doctor or healthcare provider to make sure that you have excellent blood pressure control, sugar control, cholesterol control, making sure that you're exercising appropriately. That is incredibly important in decreasing the risk of developing heart disease. And of course, stopping smoking. That is by far and away the best thing you can do for your health. And my favorite thing to say is if you do nothing else that I say, or you listen to nothing else I say, if you stop smoking, it's one of the best things you can do for your health. So now that we've talked about, again, what those risks are, how we mitigate, modify, or prevent, let's talk about recognizing the symptoms of heart disease, particularly heart attack in women. So the most common symptom of heart attack in women is chest pressure. Just like in men, it is the most common symptom. And it's normally not described as pain, but rather a pressure sensation or feeling like somebody is sitting on your chest. The classic way we describe it is an elephant sitting on your chest. The problem we run into in women is that in addition to this chest pressure or chest discomfort, women often present with a constellation of other symptoms, such as shortness of breath, nausea or vomiting, or feeling just weird indigestion type sensations. In addition to pain or discomfort in the jaw or the back, feeling hot and sweaty all over, and then extreme fatigue out of proportion to what you are doing or what you have done. So that constellation of symptoms together can make it challenging for both women and sometimes healthcare providers to really pinpoint what is going on. So it's important to know that women present with chest discomfort, normally chest pressure, but then also with these other symptoms. And these symptoms together are concerning for a heart attack. So if you have any of these symptoms, you would want to call 911 and go to the emergency department. Do not drive yourself. And so how do we diagnose heart disease? It depends on when you present. So if you're coming to the office for initial evaluation, we do a full comprehensive history and physical. And then depending on symptoms and what you're feeling, we would order other tests. Everyone gets an EKG baseline. And then we talk about event monitoring, which is a little monitor you can wear, and that assesses for arrhythmias or ectopy, which are early beats from the top or bottom chamber of the heart. So people who present with palpitations, lightheadedness, or passing out would get an event monitor. We do stress testing depending on symptoms. So people we are concerned may have a blockage causing symptoms would get a stress test depending. Some people will go directly to cardiac catheterization, or will get a cardiac CT, which is a non-invasive way of looking at the coronary arteries. So cardiac CT is a CAT scan. It's a special type of CAT scan that looks at the coronary arteries specifically and can show us both big blockages, but also little blockages. Additionally, cardiac coronary artery calcium score, or a CAC score, can be done. And that's a way to look at calcium in the coronary arteries and helps us put you in a risk category of what we think your risk for heart disease is. Lab work will be done, and cardiac MRI can be performed for certain types of heart disease. And that's usually the cardiomyopathies, or when the pumping function of the heart is weak. If you present to the emergency department and get admitted to the hospital with any type of heart disease, of course, you'll get a comprehensive history and physical, an EKG, and lab work. Additionally, echocardiogram or ultrasound of the heart will be done, and that's again, outpatient or inpatient. And some of these other tests might also be done in the hospital, including cardiac catheterization, which is a way we can invasively look at the coronary arteries and put stents in as necessary. So as you can see, we have a whole host of diagnostic tools at our disposal to diagnose the various types of heart disease. And everyone is different in terms of what testing they would need. So if you say, I came in with this one symptom and I got this, but my friend got something else, it's all very individualized and personal. So diagnosis and treatment is individualized to you based on your symptoms, your diagnoses, and what's best for you. And so here at the Riverside Women's Heart Center, we focus on heart disease in women, of course, both pregnancy-related conditions and non-pregnancy-related conditions. So in terms of the pregnancy-related conditions, people who are currently pregnant and experiencing any of the following: heart palpitations, shortness of breath that is out of proportion to being pregnant, chest pain, or anyone with known prior cardiovascular disease, including any prior history of those cardiovascular complications of pregnancy we discussed, such as preeclampsia or eclampsia. And then again, any of those complications we discussed in previous pregnancy, no matter how long ago. So that's those high blood pressure disorders of pregnancy, such as gestational hypertension, preeclampsia or eclampsia, history of gestational diabetes, preterm birth, birth weight small for gestational age, or the peripartum cardiomyopathies. And the peripartum cardiomyopathies is when the heart pumping function is decreased either during the third trimester of pregnancy or immediately after. And the other conditions that are not pregnancy related, but just as important to know about and that we treat are, again, spontaneous coronary artery dissection, or SCAD, vasospasm, microvascular angina, Takotsubo cardiomyopathy, or that stress-induced cardiomyopathy we talk about, otherwise known as broken heart syndrome. Any of the MNOCAs, so that's again that myocardial infarction with non-obstructive coronary artery disease, and any family history of premature cardiovascular disease. And the biggest thing that we focus on at the Riverside Women's Heart Center is really prevention. So if you have any heart disease, of course, diagnosis and treatment, but then also prevention of developing heart disease, because that's our biggest tool in really decreasing those numbers so that we can decrease it from 1 in 3 women will die from heart disease and 1 in 3 women will get heart disease to something much more reasonable and manageable. So here is our information for the Riverside Women's Heart Center. Thank you for joining me for our Go Red for Women talk and for Go Red for Women Heart Month. We are always here to help you in any way, and thank you.
Thank you so much, Dr. Ward, for sharing all of this information with us. It has been very enlightening and has certainly helped all of us focus on the unique risks and different ways women can experience heart attacks and cardiovascular disease. I hope everyone has enjoyed the presentation, and please keep an eye out for other future health lectures that we will share on Riverside's various social media outlets and our website. Thank you again for joining us, and I hope you have a great evening. Good night.